You sit down to enjoy a hot cup of tea or a scoop of ice cream, and instead of taking a comfortable bite, you get a sharp jolt of pain straight to the jaw. If you're over 50 and dodging your favorite foods, you are in very crowded company. Millions of adults face this every day. It is a predictable, structural reality of how human teeth age, not a sign that you've somehow failed at brushing. This guide is brought to you by The Best of Health, the trusted resource for over 50s navigating healthcare decisions. To fix the pain, we have to look at the mechanics. Over decades of chewing, brushing, and eating, the hard, protective outer shell of your tooth, the enamel, wears down. And unlike your skin, enamel cannot grow back. Once enamel thins, it exposes the softer dentine underneath. Zooming in, dentine is packed with microscopic hollow tubes acting as a highway to the tooth's nerve. Without protective enamel, hot or cold triggers travel down these tubes, striking the nerve, triggering sharp pain. The second major culprit is your gums. As we age, or if we brush a bit too aggressively over the years, our gums naturally recede. This exposes the roots of the teeth, which are highly vulnerable because they never had a protective layer of enamel to begin with. Because sensitivity is a physical exposure problem, a lack of insulation, solving it is entirely manageable. Your task is to accurately match the severity of your pain to the right intervention, balancing how much you want to spend against how quickly you want relief. For mild generalized sensitivity across your mouth, your best starting point is the cheapest and least invasive option, at-home habit changes. The immediate step is swapping your routine for a desensitizing toothpaste and a soft bristled brush. Look at how this works at a microscopic level. Active ingredients like potassium nitrate and stannous fluoride chemically interact with your tooth, physically plugging up those open pathways so triggers can no longer reach the nerve. Here is the trade-off. This method is highly cost-effective, but it is not instant. The chemical plugs need time to build up. You have to brush twice a day, every day, and expect it to take 2 to 3 weeks before you feel real relief. Next, evaluate your diet. Acidic items like citrus fruits, fizzy soft drinks, and wine actively dissolve what little enamel you have left. If you don't want to give those up, use a simple mechanical workaround. Drink them through a straw to bypass your front teeth entirely. You also need to stop brushing so hard. Vigorous, aggressive scrubbing doesn't make your teeth cleaner. It strips away your enamel and forces your gums to recede further. This at-home strategy keeps your costs near zero and avoids the dentist chair. The catch is that it demands permanent daily discipline and patience before the pain fades. If you've stuck to the desensitizing toothpaste for 4 to 6 weeks and biting into an apple still hurts, it is time to escalate to professional care. The Best of Health research team compiled this information to bring you accurate, up-to-date guidance on NHS and private treatment costs, ranging from free checkups to specialist treatments costing £50 to £200 for 2026. This comparison matrix maps out your core financial dilemma, choosing the fixed, subsidized pricing of the NHS versus the speed and advanced techniques of a private clinic. Under NHS Band 2, you pay a flat rate of £65. For this, a dentist can paint on a high-strength fluoride varnish or apply a tooth-colored resin to bond over your exposed roots. Both deliver an 85 to 90% reduction in pain. The NHS trade-off is straightforward. You get excellent financial value and highly effective functional repair, but you won't have access to premium cosmetic blending or cutting-edge technologies. Moving to private dentistry opens up advanced procedures. This includes low-level laser therapy to quickly seal those dentinal tubes, or surgical gum grafting to permanently cover severe recession. The private trade-off is steep, but often worth it for the right patient. You gain faster appointment access, superior aesthetic matching, and permanent grafting solutions, but you will pay entirely out of pocket. For cases where the sensitivity is so extreme that surface treatments fail, dentists offer an ultimate intervention: root canal treatment. A root canal physically removes the nerve from the tooth, guaranteeing a 100% elimination of sensation. However, it is highly invasive, and the costs jump significantly, up to £306 on the NHS, or as much as £800 privately. Stepping into a dental clinic forces a strategic choice. You have to decide if preserving fixed income via the NHS is more important than paying a premium for immediate, cosmetically flawless, or permanent relief. Let's map your symptoms to an action plan. If teeth feel generally sensitive for under 4 weeks, stick to the desensitizing paste. But if pain persists past 4 weeks, leverage the NHS. Book a Band 1 checkup for a professional, cost-effective diagnosis. If you prioritize speed or aesthetics, wanting immediate laser relief or advanced tissue crafting, bypass the public system and map straight to a private consultation. Finally, we need to address the medical red flags. If your pain is strictly isolated to just 1 or 2 specific teeth, that is not generalized aging. That points to localized damage. Other clear red flags include pain severe enough that it limits eating, teeth that feel physically loose, or visibly broken edges or dark cavities. If you experience any of these red flags, abandon the at-home trial entirely. Pick up the phone and demand an immediate dental appointment. Thinning enamel and receding gums are common structural realities of getting older. But suffering daily pain over your morning tea is entirely optional. You now have the exact blueprint to evaluate your symptoms and fix the problem. For more guides on dental costs, navigating NHS versus private options, and making confident health decisions after 50, visit The Best of Health at thebestofhealth.co.uk.